Types of infectious agents. Bacteria, single-celled organisms that can cause diseases such as tuberculosis, strep throat, and urinary tract infections. While many bacteria are harmless or even beneficial, pathogenic bacteria can release toxins that damage tissues. Viruses, tiny infectious agents that replicate only inside the living cells of an organism. Diseases caused by viruses include influenza, HIV/AIDS, and COVID-19. Viruses can be particularly challenging to treat because they use the host's cellular machinery to reproduce. Fungi. These organisms can cause infections like athlete's foot, ringworm, and histoplasmosis. Fungal infections are more common in individuals with weakened immune systems. Parasites, organisms that live on or in a host organism and get their food at the expense of their host. Malaria, caused by the Plasmodium parasite, is a significant parasitic disease affecting millions worldwide. Transmission of infectious diseases. Infectious diseases can be transmitted in several ways. Direct contact, through physical contact with an infected person, such as touching, kissing, or sexual intercourse. Indirect contact, via contaminated surfaces, objects, or vectors like mosquitoes and ticks. Airborne transmission, through droplets expelled when an infected person coughs or sneezes. Food and water, consuming contaminated food or water can lead to diseases like cholera and salmonella. Prevention and control. Preventing infectious diseases involves a combination of personal hygiene, public health measures, and medical interventions. Vaccination, one of the most effective ways to prevent infectious diseases. Vaccines stimulate the immune system to recognize and fight pathogens. Hand hygiene, regular hand washing with soap and water can significantly reduce the spread of infections. Safe food practices, proper handling, cooking, and storage of food can prevent foodborne illnesses. Vector control, measures such as using insect repellent and bed nets can reduce the risk of diseases transmitted by insects. Treatment. The treatment of infectious diseases depends on the type of pathogen. Antibiotics, used to treat bacterial infections. However, antibiotic resistance is a growing concern. Antivirals, medications that can treat viral infections, though they are often specific to particular viruses. Antifungals, used to treat fungal infections. Antiparasitics, medications that treat parasitic infections. Emerging infectious diseases. New infectious diseases continue to emerge, posing significant challenges to global health. The COVID-19 pandemic, caused by the SARS-CoV-2 virus, highlighted the importance of preparedness and rapid response to infectious disease outbreaks. Other emerging diseases include Ebola, Zika, and novel strains of influenza. Conclusion. Infectious diseases remain a critical area of concern for global health. Understanding the types of pathogens, modes of transmission, and methods of prevention and treatment is essential for controlling and mitigating the impact of these diseases. Continued research, public health initiatives, and global cooperation are vital in the fight against infectious diseases. If you have any specific questions or need more detailed information on any part of this topic, feel free to ask.